Well, let's return now to one of our top stories, the coronavirus outbreak. For more, we're joined live by the AMA President, Dr. Tony Bartone. Appreciate your time, Dr. Bartone. I understand that this week you've met with the Deputy Chief Medical Officer for an update on the coronavirus strategy. In a nutshell, what is our strategy and how confident are you that we can prevent this virus spreading throughout Australia?
Good afternoon, and thanks for the opportunity of talking to your viewers. Look, the strategy is clearly one that's been really there right from the beginning, and that is about either isolating any cases, containment, and then quarantining or keeping them from the general community, where either by self-isolation or on larger scales by quarantine facilities, by having the contact tracing for any notifiable cases that do come through the system, but then really just in terms of reassuring the public that it is an important time to be very vigilant and be very alert, but not to be alarmed and to go about business as usual, you might say. So clearly
But Tony, yesterday Sorry, I was just going to point out that yesterday New South Wales Health was on the hunt for 4 people who'd been on a cruise ship that docked in Cambodia. Those people were wanted for screening here in Australia but had disappeared, and authorities put out the call that they wanted them to come forward so they could be tested. Today we're seeing reports in the Australian newspaper that Chinese travel agents are offering these travel packages via a third country transit destination to try and help Chinese students get around the Australian travel ban. Considering all of that, should it really be business as normal here in Australia? Can you understand why Australians might be worried?
Well, let's put it all into context, Ashley. So it's very important to understand that if you look at so far of the 15 cases, half of them are recovered and following proper protocol, and they're back out into the community. We've had a clear ability to maintain the load in the face of what, if you look in other countries where significant issues have been occurring. Now, further to that, we've got the guidelines in place, and the government has exercised that abundance of caution when it came to travel policy recommendations about visiting China and the restrictions coming back in. Now, of course, this is where you can't have an obviously very 100% foolproof system. But if the measures are followed and everyone is playing their bit in the system, you'll minimise any of these so-called leaks. In terms of the reference to the novel approach to companies trying to market travel packages to students, understand that at least they are 14 days out of the centre of the epicentre of the focus of the quarantine at this stage. So in that respect, that's not a flagrant flouch, you might say, but it's still a very something that still needs to be monitored, and obviously universities and other authorities will have their role to play when these students start to come in through the various channels back into the schools, because they've got a duty of care to protect and provide a safe education place for all who attend. So at this stage, it's still follow the advice of government and health authorities. That's been very clear from the beginning. It's about communicating that message more robustly to all the health providers and in the community. It's about having consistency in that messaging. There's been differences between states and territories, which is a feature of our federation, and so we really need to be very mindful that there's still more to be done, but we don't need to be fearful of a mass breakout because someone's wearing a mask down the middle of the main street of Sydney or Melbourne.
Here at Sky News, we understand that it is likely the travel ban will be extended this afternoon when the National Security Council of Cabinet meets to make that decision. Would that be a wise move from a medical standpoint?
The decision to extend that ban will obviously be based on feedback from both the medical the medical personnel advising government and the Security Committee directly, but clearly would be in line with the current observations that we're still getting in reported cases, both in China and the other parts around the world. So that decision is obviously going to be made by government, but would be one that would be consistent following current observations.
Dr. Tony Bartone from the Australian Medical Association. Appreciate your insights with us this afternoon on Newsday. Thank you.
Thanks very much, Ashley.